Newham faces health inequalities in two ways. So first, there's how Newham's health compares to the rest of the country. And on nearly every measure, residents in Newham are doing worse than other people in the country. And that's primarily because of long-term drivers of health outcomes, so what we call social determinants of health. And the important thing in Newham is that health outcomes are lower pretty consistently across the board compared to the rest of the country.
One of the reasons why I'm impressed by the University of East London is they understand the importance as an anchor institution, the responsibility they have to this community. And that's one of the reasons why I was really pleased to come to the launch of the new health centre that UEL have set up. The work the university is doing, training up health professionals, the work the university is doing, working with communities, including the council. And I'm really impressed and pleased and proud to be associated with the university that has such great work in the community.
As a Palestinian, it wasn't easy at all for me to start my master at the beginning of what's happening back home. So I reached a huge amount of support from my lecturer in terms of exams or essays, if I need extension, or if I need any kind of help, they're always there.
I think many other universities can learn that it really is important to get engaged in the community, and that's really, I think, what's driving the initiative that UEL has started. They really are working for the community to make a better community for everyone.
There's lots that other healthcare professionals and other providers can learn from the University of East London. There's a lot of it is around trying to understand what are the needs within the community. We're working together to say, actually, how can we best equip the future generation of medical practitioners, and perhaps to also future scan. And if we're future scanning some issues that we're thinking actually down the line, these are the things that we're concerned about, we can work with the university to look at actually how can we equip the future generations to better that, and using the university to collaborate in looking at things like research, and can we work together to try to bring providers together with the university as the hub to improve the care locally.
I learned so much from the team about their research, and it's made me think carefully about how to parent my children, both of whom participated in various studies. My son was involved in one of the studies about the positive impacts of outdoor learning environments, and we spent a lot more time outside because of everything I learned about during the study. I've noticed how much calmer, engaged and clear-headed he is when he's been set free to climb a tree or dig in a muddy puddle.
We have many children that are in HMO housing, so they are limited to the amount of outdoor space that they have. They're limited to the amount of where they can go and exercise. They're limited by the amount of pollution that we have in this area. So what we've wanted to do is to work with the University of East London about, so if we're having these challenges, what are the levers that we can enable us to change that? How can we learn from the thinking and the theoretical understanding that's come from the writings of Gemma Goldenberg and Sam Weiss to enable those children to be successful in school?
Really, when you talk about the role that UEL has played, certainly in this part of London, it's played one of the biggest roles in terms of serving local people and influencing health.